This is Fit to Succeed in partnership with NordicFitnessEducation.com with hosts Ben Pratt. Thanks for joining us.
The thing I love about magnesium is such broad-ranging effects, and it does so many things. And the other thing about it is that this is a big deal as far as supplementing. If I give somebody magnesium and I never see them again, and they take magnesium for the rest of their life because Dr. Teta said to take magnesium, I can rest assured that they're going to be having a higher quality of life within rare exceptions, right?
Hello, listeners, and welcome to this episode of the Fit to Succeed podcast. I have a colleague and friend here. His name is Keoni Teta. He is a naturopathic physician. He has his own podcast called the Wellman's Podcast, and he also, you can find more about him on his website at keoniteta.com. Keoni, it's great to have you with us.
Ben, it's good to see you, man. I'm happy to be here.
Yeah, I'm happy to have you on. It's kind of been in the planning for a little while, this one, and it's great to have someone of your expertise to come on and discuss today's subject, which is supplementation and how we use supplements in the health space.
Right.
So perhaps we might, before we jump into that subject, Keoni, we might just start with a little bit more of some generic principles. And I would like to ask to begin with, from your perspective, what role does diet versus supplementation play in that journey to achieving good health?
Right. Well, diet is key. Diet is the foundation or part of the foundation. And before I even jump to supplements with my patients or the athletes we have or consult with us, is we want to make sure the lifestyle stuff is in order, right? So that's the foundation. So diet is part of that. Sleep is the other part of that. Stressors, psycho-emotional stressors that are going in their life. That's the foundation before we even get to supplementing. Because if that's not in order, the supplements are going to be a waste of time and money.
Absolutely.
So we want to get the foundation first.
All right. So that sounds to me like your perspective is get the diet and some of the lifestyle factors down, and then we can then turn to supplements. Is that correct? Yeah,
that's absolutely correct, because what I find is the simplest things, especially in medicine, but also as far as enhancing athletic performance, is it's the foundational stuff. So it's like, for an athlete, one of the most ergogenic aids out there is making sure that you have adequate hydration. That's key. For diet, it's like, if you're drinking tons of sweetened drinks, sodas and juices, it doesn't matter what supplement we give you, that needs to be taken care of first. We want to switch you to, water or non-caloric, unsweetened beverages first, or make sure that's the primary thing of what you're doing in your lifestyle as far as fluid intake goes. So that, and everybody has weak links there for the most part, So that's where I go first.
You just mentioned there an interesting one, which was hydration being such a key factor for performance. I wonder if there's any other dietary principles, maybe one or two other dietary principles that you would use to encourage an active individual to follow?
Yep. So, I don't want to demonize any macronutrients out there. So, and it seems like with each passing decade, we have a new macronutrient that is going to be demonized. And right now it happens to be carbs. Okay. However, I will say about carbs, I feel like most Westerners, most people go overboard with their refined carbohydrates. And I think that is the macronutrient that has to really be looked at and minimized. And I say refined carbohydrates, we're talking about the white foods, right? So we're talking about flours, cakes, cookies, just think about the junk food stuff. That stuff has a significant impact on insulin levels, more so than non-refined carbs or fat or protein. And I like to just simplify things and boil it down, but when we look at chronic disease and even with athletes, one of the big things is overconsumption of calories, and it's very easy to overconsume calories when you're doing these refined carbohydrates. They're not very satisfying or satiating. We can certainly overdo them, and they're everywhere. They're everywhere. So typically with most of my clients, I'm looking at that and seeing, okay, what do we need to do here? Now, with a lot of my athletes and patients, one of the big things they come to me with is weight loss. So that's the first macronutrient I look at. I'm like, okay, let's see what their carbohydrate intake is, and is there weight that needs to be lost to enhance performance, not only for the average person, but for the athlete. And that's where I go first.
Yeah, and I think that makes a lot of sense. Although one of the dichotomies that we have to unravel, I suppose, with regards to the athlete is, there's a lot of evidence to show that carbohydrates are very beneficial, particularly for higher intensity sports. And
Right.
so do you have any thoughts on how you find that appropriate balance when you're working with an athlete or an active individual for the amount of carbohydrates that's right to support exercise, but without exceeding their calorie or carb needs to lead to weight gain?
Right. So it's really has to do with the athlete and if there is weight to lose, right? So if you're an endurance athlete, it's very important to make sure that you're maintaining your weight, an appropriate weight. You don't want to be carrying around extra pounds when you're running a marathon. And for most people who are athletes and train at an elite level, a lot of times weight is not an issue. It's a non-issue what they're eating as far as their carbohydrates. In fact, having more of a refined carbohydrate may be a good thing. But for the average person, it can be really a problematic thing. Or for the average person who wants to lose weight and just have better function in life, then it can be an issue. So yeah, you're right. Like that, I could probably make a case in rare exceptions where having your junk food is every now and then would probably be fine and may allow somebody to go that extra mile. I use this a lot with children. I have a lot of parents who come into me and be like, oh I just can't get my kids to eat their veggies or any green stuff. And the first question I ask them is, are they active and do they have a weight issue? And if they don't, I'm like, well, really don't worry about it, except in the fact that, try to be a mentor in the fact that you eat it, because what the research shows is over time, children will take on the habits of their parents as they get older anyway. So activity levels, huge for that, especially with that population group. But for elite athletes, really, it can be a non-issue. But sometimes for somebody who wants to get an extra, 30 seconds shaved off their times and stuff, sometimes you want to look at their muscle mass to fat ratio. And sometimes the looking at refined carbohydrates may help with that.
Okay, I can see where you're going with that one. If someone is lean and they're very active, it's not really so much of a concern. We would probably want to choose better carbs where we can, but the amount of carbs may be less of an issue. Where for a lot of personal trainers, for example, they may be working with regular clients who are just trying to increase activity. And if they have some weight to lose, then really carbohydrates is something we have to consider alongside the exercise. It can't just be do more exercise.
Exactly. Yeah.
I get you. Okay, so let's just switch gears to the main topic of today, which is about supplementation. I'd like to know, Keoni, is there any principles that you follow that govern how you prescribe supplementation? Some overarching rules that you might follow before you say you need to take this supplement in this amount?
With my clients, it's basically, you take a history, right? You do the foundational stuff, make sure all their lifestyle stuff is in order. And then based on that history, you will assess, is there possibly a deficiency or subclinical deficiency in some type of nutrient or supplement or anything like that, right? And then you also will use objective data. So sometimes testing. Really, that's my guiding factor. And then as far as supplements go, well, which ones are right? So let's take example, let's take example magnesium. Most people are subclinically deficient in magnesium, meaning that, we could probably run a blood test and not really see that they're deficient, but we really don't know what's going on inside the cell. But let's say the average person comes to you and says, yeah, I can't, I'm having difficulty sleeping. I have chronic headaches. I'm getting weird cramping or muscle spasms when I throw my back out every so often. there's a little bit of heart disease in my family. And what I like to do is I have this therapeutic order where, again, I go back to my principle. Some of the most non-invasive forms of medicine, magnesium being one of them, have some of the most powerful, broad-reaching effects within the body, and can take care of all those issues that I just mentioned. Then the next step would be, okay, so magnesium may be a good option for this person to take, all right? But then the next thing is, okay, what form of magnesium? And there's different forms of magnesium, and they do different things. So for example, if there is a constipation issue with this person, then I would probably choose a form of like magnesium oxide, which doesn't really get well absorbed into the body, but has an osmotic effect in the intestines, which can create peristalsis, which can get the bowels moving, right? If that's not an issue, I may choose a magnesium form that's bound to an amino acid, which are much better absorbed. The one, for the one that I really like would be like something like a magnesium bisglycinate, which is bound to like glycine molecule, which glycine in itself as an amino acid seems to help tone down the noise along with magnesium in the brain. However, if sleep is just an issue and, the mind is constantly racing at night, I may use a magnesium like magnesium threonate, which seems to have pretty good brain effects as far as like toning down the noise. And the thing that I love about that, and magnesium is just one of many nutrients, but the thing I love about magnesium has such broad-ranging effects, and it does so many things. And the other thing about it is, this is a big deal as far as supplementing. If I give somebody magnesium and I never see them again, and they take magnesium for the rest of their life because Dr. Teta said to take magnesium, I can rest assured that they're going to be having a higher quality of life within rare exceptions, right? So then I think about the side effects. All right, so what could possibly happen if somebody's taking magnesium where it would be contraindicated? And there are areas, right? So if somebody is on, for example, has to be on an antibiotic, taking magnesium with an antibiotic is not a good thing. It can prevent the absorption of the antibiotic, right? It's certainly, and that way indirectly can hurt them. Another thing to think about is, somebody who has poor kidney function or is going into kidney failure. Magnesium may be an issue, but for the average person, I could sleep well at night knowing that, man, this person is on magnesium and it's going to serve them well for the rest of their life. And then the other point about that, and I think me and you talked about this, is I am a very, very big believer, and it's my bias that, I'm certainly not against pharmaceutical drugs, and they have their place. But when I can use some sort of natural nutraceutical in place of that without putting the person at risk, that's the way I want to go. And the main reason I do is because our DNA knows what the hell to do with magnesium. It speaks the same language as magnesium, so the body knows what to do. So if you take a statin drugs are, used to lower cholesterol levels. Yeah, it may lower cholesterol, but honestly, we have no idea what it does to the rest of the body, especially long term. And it's not that taking a statin drug is inherently bad, and it may do the job, but, we know that a lot of these drugs will create nutritional deficiencies, can create all kinds of negative side effects because they don't speak the same language as our DNA, and we have no idea what it does to the rest of the body.
Yeah, I remember discussing something along those lines with you previously regarding using natural occurring nutrients that have limited side effects because, as you said, somebody can take them without too much concern that it's going to potentially cause them any problems. And I think that's really valuable. It leads me to kind of the next thought processes, though, which is, you mentioned there's so many different types of magnesium, and there's more than just the ones that you mentioned, oxide and citrates and malates, bisglycinates, threonates. There's so many different kinds. Even the different types can be confusing to people, but then we've got different brands that are selling the same type but maybe using different fillers. Do you have any guidance or thoughts you can offer the listeners on how do you choose between all of the myriad of brands and types to know which companies you should rely on to buy good quality supplements?
This is where you really have to do your homework on this because, as a physician, I get bombarded. Like today, I think I'm meeting with a supplement rep today who's coming in, and I can tell you what they're going to say to me. They're going to say, this is the best supplement to take, the best magnesium to take, yada, yada, yada. So, and again, they have a bias there that, they're trying to sell the product, so you kind of have to do your homework on it. And I really like looking at where is this magnesium coming from? What are the fillers in there, and does it really make a difference? Is it going to be well absorbed? So, for example, a lot of magnesium supplements will come in gel caps. For some of my patients, the gel caps or any type of pill is hard to swallow. So then I probably want to do a powdered form that can mix in the water. But then there's also certain supplements that come bound to like a magnesium, a filler with magnesium stearate in it, which
that's the common one.
Yeah, which isn't well absorbed. But I haven't, if I can find it without that, I would prefer that, but it hasn't really been an issue. And then the other thing I do is look at the suppliers, and one of my favorite suppliers of the minerals, and it's well known, and most magnesiums, at least the pharmaceutical grade ones that are marketed to physicians, is a company called Albion Minerals, which they really do a lot of research on it, and so I like to look for that Albion Minerals as a supplier for magnesium. But you're right, you want to do your homework. And let me give you another example. Let's switch to another nutrient called carnitine or L-carnitine. And a lot of, it's kind of online gotten kind of the reputation of being perhaps an ergogenic aid.
Yeah.
And does that really play out in the research? And I would say probably not right now as an ergogenic aid. And then as far as, are you getting a good product? Well, there's different forms of carnitine. There's the L form, right? The L-carnitine. There's the R form. And some of these supplements are putting the R form in there, which is not, your body doesn't know what to do with that R form. And it's a way to cheapen it. So you want to make sure you're getting pure L-carnitine. So you kind of have to do your homework on what is in there. Like if you're going to get carnitine, it shouldn't be the racemic mixture of L and R.
I'm with you. So it sounds, if I was to kind of summarize what you're saying there, Keoni, that there is no easy route or way to know what are the best supplements, but you've just got to be doing your due diligence in your research to then determine whether those supplements, come from good quality suppliers, whether they've used good fillers or binders, whether it's the right form your client can take. You've just got to be a bit more thorough rather than just going, this brand is brilliant.
Right. And for the average person, who's going to take the time to do that?
Exactly.
So they're going to depend on people like me and you to do our homework on that, or maybe from this podcast to figure that stuff out. Otherwise, it's marketing. Who has the best marketing strategies to get their supplements out there?
Sure.
But there's a lot that has to go into it with thinking. Like, a lot of it can be a waste of money. For the average person if they don't know what they're doing.
I would say the other thing I would add to that, in my experience in working with clients, that occasionally I've used what I thought was a good supplement. It's worked with people in the past, but then I find that there's a client who just doesn't respond the way you normally anticipate. And so I've often found that I might actually have 2 or 3 preferred suppliers, and then that way, if one supplement doesn't work with a particular client for whatever reason, I might suggest a different version or a different form, like you said, to see how that works.
Yeah, and a good example of that is whey protein, right? So I have whey protein for athletes, for the average person, for the average bodybuilder or person who wants to get fit, help with muscle mass. Whey proteins, I've used a number of them, and I have some really wonderful whey proteins. They're the pure forms of whey protein. The New Zealand whey kind of is the gold standard, But again, you have to be careful about a number of things, right? So at least in the U.S., I can call my whey protein New Zealand whey protein, right? If it has like 5 to 10% of New Zealand whey.
Wow.
So those are things to look at. But then I go even further than that. So if you're a client, you read all this good research on whey protein, and there's a ton out there on whey protein as far as protein supplements go. But if you take whey protein and it gives you digestive upset, makes you gassy and bloated every time you do it, it's not for you. It's not, you're not absorbing it. You may need to switch to more of a plant-based protein. So it's like, what can you assimilate well is huge with how the client responds. And you're right. Like, one brand may work for somebody, you give it to somebody else, and for whatever reason, it's not the way to go.
Yeah. Pardon the pun there, but that's okay.
That's right.
Now, on that topic, then, you've just introduced the idea of whey protein, and that's obviously one of the main supplements people might turn to when they're looking to recover from exercise, when they're looking to build muscle tissue.
Right.
Beyond just getting protein in adequate amounts, is there any other supplements that you might encourage people to consider when they're looking to grow new muscle tissue and to bodybuild?
Well, okay. So again, let's go back to the foundation, because with athletes who want to get more muscle mass and tissue, the two things I look at first before I even go into the macronutrients, are they getting enough calories and are they overtraining? Excellent. Yeah. Right. That's where I go first, because if you're not getting enough calories, you're not going to build muscle based on your activity level. And a lot of people, are on these I see them low calorie diets and wondering why, or just exercising every day with the whole concept of more is better. And that can be problematic. So you really have to get the foundational stuff right. And then as far as,
so let's assume that those things are in place. So the person is training appropriately, they've got enough calories coming in, and they've got an adequate daily protein. So those bases are covered. Is there anything additional you might consider?
Right. So then we want to go to the place where, okay, what do we know will help with muscle mass and actually aiding performance, and that has some science behind it, right? So making sure your protein levels are appropriate, and whey protein has some of the most well research on it. I mean, it's so in so many ways it helps, and so I feel like whey is king as far as compared to the other ones right now with the research. So egg protein, pea protein, rice protein, even the hydrolyzed beef protein. I'm sure all those are good. I just haven't seen a lot of studies on it. Whey has the most, so that's where I would go with it if they can assimilate it pretty good. And then, we mentioned it a minute. So if we're talking about performance, athletic performance, the most ergogenic aid is making sure you have adequate hydration. But now let's talk about the supplement that I feel like is king of, and it has a ton of research on it, and it seems to help with performance. And it also seems to help with allowing you to exercise longer and harder, and that is creatine monohydrate. To be, there's a lot of research out there that can, that just shows that it's one of the most effective ergogenic nutritional supplements that's available to athletes or the average person who just wants to get more out of their workout.
Yeah, for sure. And creatine is pretty good at giving, a little bit more freely available ATP production in the muscle tissue to generate that little bit extra energy to push that wee bit harder. That's kind of its primary purpose.
Right.
It's interesting you mentioned that, because I did some research a while back on creatine and came across a meta-analysis that had looked at 500 studies across creatine monohydrate. And just to sort of give you a sense of the amount of research, listeners, there's so much out there.
Right.
And one of the things they drew from that was that not everybody responded to creatine. It was probably between about 50% to 60% of individuals who took it responded effectively, whereas some became what they referred to as non-responders and didn't always see the results. So it can be effective, but I suppose it depends on, your own personal genetics.
Right. And let me go to another place. And it's hard to get these in the U.S., but I think you can get them in the UK as far as supplements go, because I think they're readily available in the UK. Are SARMs readily available? Can you buy those over the counter? SARMs, so selective androgen receptor modulators. They come in they act like androgens, right? They act like taking steroids. But I just.
So you're talking about things like, for example, like DHEA or something like that?
Well, no, I would call that more of a pro-hormone, but or a hormone the body uses, not necessarily a pro-hormone. But But anyway, there's selective androgen receptor modulators. The WADA Association, it's banned from athletic performance, but I do see people in the gym using these who aren't going straight to steroids.
Yeah, so it's not an illegal thing to take, but it's not legal. It's not allowable for sports and professional sport, is what you're saying.
Right. It's not. Yeah, it's not allowable for. So that, you want muscle hypertrophy. I've seen it work. It seems to work pretty well. It's close to that. But again, you have the same negative side effects that you would with taking like androgens, like testosterone and the different forms of testosterone out there. Excellent. So it has a downside to it. So I feel like, and there's safety issues with that. Whereas with creatine monohydrate, the safety issues are much, much lower.
Yeah, they're pretty minimal for sure.
Yeah, they're definitely minimal. And then I agree with what you're saying. Like, certain people respond for whatever reason, and certain people won't respond for whatever reason. And that's just, something you have to go through. But as far as the research goes, there's tons of research on it. And that's what I like to see.
And I think that responder, non-responder sort of idea or concept actually goes across a lot of supplements. It's not just creatine. In lots of cases, we'll find people who respond or don't respond. And so we shouldn't, I suppose, get too upset if we take something and it doesn't seem to work. It may just be that it's not right for us individually.
Right.
I wonder if we could change direction just a little bit, and let's ask the same sort of question here. I know particularly yourself and your business associates, you guys have worked a lot in the field of weight loss and metabolic health. Is there any, assuming again that people are following dietary strategies, is there any beneficial supplements that you have turned to in the past to aid weight loss, in particular naturally occurring, that sort of thing?
I go back to the basics with that. And I think, as far as weight loss goes, what my strategy is with that in general, everybody's not the same, but my strategy is this. I want to make people more insulin sensitive so they become better fat burners, right? And one of the ways that I will do that is really look at the refined carbohydrate, try to lower that. Therefore, we can lower insulin levels. And then I look at satiating nutrients that are out there, right? Macronutrients. And one of the most satiating is going to be protein. Okay. If people are getting adequate protein, not too much, but getting adequate protein, they can tend to be satiated, and they're not going to have as many cravings for food as such. Now, there are other things out there, again, as far as supplements go, that can aid in helping with weight loss. But again, it's not foundational. So there are certain things like adaptogenic herbs, right? Make sure your adrenals are tonified to some extent. So we're talking about herbs like ashwagandha, rhodiola, what else? Panax ginseng. Some of these things I'll do to just help with their stress response. But again, it's not a wow factor that where people would take this and be, oh yeah, I'm losing a ton of weight. The wow factor comes from really, if we have to go back to anything, then it really comes, and this as well as I do, is that, let's go back to making sure that we have a hormonal environment in the body that allows you to burn fat. And what are one of the best way, and the hormone that we really want to lower if there's a weight issue is insulin.
It's going to be insulin.
It's going to be insulin. And so what is the best way if let's say you do have high insulin, right? And so without doing tests, you can pretty much look at somebody, right, and say, okay, their insulin levels may not be appropriate. So what are we looking for? We're looking like, okay, the belly over the belt, so to speak, right? We're looking at possibly a little bit of muscle wasting in the legs and the arms and stuff like that. But if there's any weight gain around the torso, which as we get older, insulin that happens, insulin may be an issue. So how do we get a break from insulin? Well, we look at the refined carbohydrates, and one strategy that I love, and it goes all the way back to the days of Socrates. It said, when there is disease in the body, one of the primary ways to help people is to fast them. And to a lot of people, they're like, oh, well, wait a second, that's like dieting, and I can get rebound. But the research on intermittent fasting is profound, and clinically, from what I've seen, it's one of the best ways to lower insulin. So what are we talking about? We're talking about having discrete meals, making sure those meals are healthy, where you lower your refined carbohydrates, right, to a certain extent, and that you don't snack. So at least in the U.S., I was raised, and maybe it's the same way in the UK, where culturally you're raised to believe have a breakfast, have a lunch, have a dinner, and then if you really want to be healthy, have snacks in between, and then have a snack before you go to bed. Now, what does that do to insulin levels, right? It just keeps raising them up as the day goes on, and you don't really get a break.
Sure.
You know, and especially for adults, maybe not for children, but especially for adults, you know, taking a break between your meals helps optimize insulin levels so that you're a more efficient fat burner. And there's ways to enhance that with dietary strategies. Hence, you know, the ketogenic diet and stuff like that, which can raise ketones and lower insulin. But I tell people, like, if you want a strategy where you don't have to take anything and that will save you money with weight loss and help you feel good and not put too much stress on your body and give you rebound weight gain, try the intermittent fasting. And there's no, in my opinion, you take the person where they are, and that fasting is, okay, if you normally eat every 4 hours, extend it a little.
Sure.
To like 6 hours. Most people can do that. And then if you're getting good at that, then every so often, once or twice a week, go 18 hours without food, right? So that would look like from 7 o'clock in the evening, you have dinner, to 1 or 2 in the afternoon, that's when you have your next meal.
Sure.
And if your body's not used to that, that creates so many health benefits, it's unreal. And I've experimented this with my patients, and one of the main benefits that I get back from this, besides the weight loss, is, yeah, I just can't believe how much money I save in my food bill because I'm not eating. You know, and you can never catch up, right? So you can't you have a caloric deficit without creating a stress on the body where you're just doing a low-calorie diet every day because you know you're going to eat within a few hours. But you, at the end of the week or end of the month, you're in a deficit of, who knows, depending on the time, you know, 2,000 calories, 10,000, 20,000 at the end of the month. You can't catch up to that, and you're still at that caloric deficit. And it mimics the way our natural physiology is, and me and you wouldn't be here if our ancestors didn't go through something like that, our ancient ancestors. That's a great weight loss strategy that most people can, once they hear the science behind it and hear me talk about it, they can use that strategy as a lifestyle change for the rest of their life. And guess what? They don't have to be so neurotic about not having a piece of chocolate cake or not having, you know, a piece of bread or, you know, whatever, you know.
Sure, I'm with you. I think that's pretty useful and a nice sort of rebalancing of where we were going, you know, to sort of focus on that dietary strategies are still king no matter how much we talk about supplementation. Unbelievably, we're nearly up on time, but there's one quick question I want to tag on the end of that discussion, and then I'm going to ask you for one final bit of advice.
Okay.
And the quick question is, a lot of weight loss supplements, the ones that certainly market themselves, when you actually look into the ingredients, I often notice that things like caffeine and guarana and ginseng and sort of these stimulating supplements are part of the underlying, active ingredients. Is there any evidence that you're aware of that these things can be effective at increasing fat burning?
You know, I've seen plenty of patients over the years on these things, and you know, you can get some benefit. I think the benefit is minimal. I've seen some benefit from it, and there is some research that shows that you can get some benefit taking caffeine to, you know, just speed up the metabolism. But again, it's not sustainable. It's not something you want to do long term. So overall, I would say, yeah, there's some benefit, but it's not going to be a wow factor. I would say the same thing about the prescription meds for weight loss. It's the same issue. It's like if you don't get the lifestyle stuff in order, you're fighting a losing battle.
Right.
Don't depend on the pill. You know, and I wish there was a pill. really wish there was a pill out there that can just, you know, help the body in so many ways and help optimize weight. I just don't see it yet, you know. But you'll find studies out there that show there's benefit, you know. There is benefit, and there's studies on Chinese herbal formulas, and, you know, that show all kinds of things like that. But again, it's like there's no wow factor to it. That's what I want to see. I want my patients to have that wow factor, not me. I want them to be like, yeah, this works. You
All right, nice, nice. And so the last question, and we've talked a lot about supplementation and the potential roles that it can have with regards to health, lifestyle, activity, weight loss, things like that. But just to sort of end the conversation, I wonder, Keoni, is there any precautions you would offer for those who are utilizing supplements as part of their daily health regime?
Yeah, I just talked about this with a patient yesterday. If you get online and you're looking to lose weight, or let's say you have a dire diagnosis, let's say you have a cancer diagnosis and you get online, you will find an article somewhere out there that says this supplement, I don't care what it is good for cancer or good for weight loss. Okay, so what ends up happening with most people is now they come into me with a trash bag full of supplements that they're taking because they read something that this helps. And ultimately what it becomes is the problem is you're taking too much stuff, right, and you're not going back to the basics. And with prescription meds, I say the same thing. So for example, at least here in the US, medicine is so specialized now. And it seems to me, being a natural healthcare practitioner, I no longer prescribe prescription meds, but a lot of people, especially when they get to my age and older, are on like 10 up to 17 different prescription meds. And usually their health problems are no longer the issue they got them on the med in the first place, right? It's because of all the meds they're taking and the different interactions and stuff. Mm-hmm. So I think if you're that person who's taking, more than 3, 4, or 5 supplements every day, I think you have to really look at, what you're trying to do and are the basics in order. And so I go for that. There are certain things out there that that I think are a good baseline thing to think about, right? So I think most people benefit, and I think the research bears this out, to be on a good multivitamin, And what does good mean? Well, it goes back to your question. Like, you want to make sure that it's good for you. So for example, for men who don't menstruate and have a period, probably don't want to be on a multi that has a lot of iron in it, right? We know iron can act as an oxidizer, that type of thing. For people who have a problem with metabolizing folic acid, you probably want to be on a multi that has real folate instead of folic acid, Right. For somebody who may be subclinically deficient in vitamin A, you may not want to have a multi that has all beta carotene as the vitamin A. You may want, vitamin A palmitate. So you have to look at that. But I think a multivitamin for most people is a really good thing. And then I also think, I think the research on making sure you're getting essential fatty acids is good. So that may be key for people. And then one thing that I just love in my clinic, because there's so much research on it, a big part of disease is just inflammation in general. And inflammation can be generated by, over-exercise or stress or just overconsumption. And there are things out there, as far as supplements go, that have tons of research on being anti-inflammatory, right? And work better in pilot studies than a lot of the NSAIDs out there. And that's curcumin, which is a constituent of the herb turmeric, which is a spice. And, we talked about spices before. In your cooking, use spices, use a lot of different of them. They have a lot of like anti-inflammatory capability, but the research, as far as king of research and the studies out there, turmeric and really the main constituent in turmeric, curcumin, has a lot of anti-inflammatory activity. And you're not going to get yourself in trouble with it, right? You can probably, the only way you get in trouble with it, if you jumped in a pool of turmeric and drown. There is an exception, right? So if you're going in for major surgery, one benefit of curcumin is it can thin the blood slightly, which is good for most of us. It's not going to be like a prescription blood thinner, but if you're going for surgery, it's probably best to stop it for a week or two beforehand and get back on it. So I think
that's some pretty useful overall advice there, Keoni. If you're taking too many supplements now, you've got to probably look at what your basic diet and lifestyle is like, to why you're having to almost put a Band-Aid on so many different parts of your diet. And if you are going to look at taking some supplements, perhaps the multivit, the essential fatty acids, and curcumin might be a good place to start as a universal point of health.
And the other one I'd add into that maybe, but it would be in your multivitamin, would be magnesium. Make sure you get a little bit of magnesium in there.
Oh, fantastic. Keoni, it's been such a pleasure talking to you and to really pick your brain on this whole range of issues around supplementation and diet and how those two can actually work together once we've got that foundation in place. I really appreciate your time today.
Yeah, thanks for having me on, man. It's always a pleasure. It's always a pleasure talking to you.
No worries. And of course, listeners, we will link you up in the show notes to Keoni's website and also his podcast, the Well Man's Podcast. So again, thanks very much, Keoni, and you have yourself a great day.
Thank you.
If you enjoyed this podcast, please subscribe and share via social media. You can also rate the show on iTunes, Stitcher, or YouTube. If you'd like to know more about us, then check out our range of online courses at www.nordicfitnesseducation.com.